بسم الله الرحمن الرحيم. هذه المحاضرة هنكمل عن الهربس زوستر. المحاضرة الثالثة. Immunosuppression increase the risk of zoster. Although studies vary as to the impact, the uses of a tumor necrosis factor inhibitor was initially reported to increase the risk of development of zoster by 1.6 or 60%. Although large cohort studies suggested no increased risk with monotherapy, only an elevated risk with combination of tumor necrosis factor inhibitor and methotrexate. This risk is significant enough that a prophylactic immunization should be considered, if not contraindicated before the patient starts tumor necrosis factor. إذا immunization not contraindicated ننطي prophylactic immunization قبل لا البيشنت start tumor necrosis factor inhibitor. Varicella zoster virus immunization of patient already receiving tumor necrosis factor inhibition who have had prior varicella has not led to an increased risk of zoster or adverse event. And it has reduced the rate of zoster with anti-tumor necrosis factor therapy. يعني الاميونيزيشن ما زيدت الريسك اللي البيشنتس اللي عنده سابقا مثلا فارسيلا، وبالعكس هي قللت الريسك of herpes zoster. This strategy should be considered on case-by-case basis, perhaps in consultation with an infectious disease specialist. JAK inhibitors overall appear to carry an elevated risk for zoster, although there may exist variability based on which particular JAK inhibitor is used. Example, limited data suggest filgotinib, a selective JAK1 inhibitor, may have lower rate of zoster than the others. Pre-treatment immunization is ideal if feasible. إذن هسه صار عندنا tumor necrosis factor inhibitor combination with methotrexate and JAK inhibitors. هذول يحتاجون immunization before starting treatment. Patients with malignancy, especially Hodgkin disease and leukemia, are 5 times more likely to develop zoster than their age-matched counterparts. Patients who have higher incidence of zoster include those with deficient immune systems, such as individuals who are immune suppressed from organ transplantation or by connective tissue disease or by the agent used to treat these conditions, especially corticosteroid, chemotherapeutic agents, cyclosporine, sirolimus, and tacrolimus. After stem cell transplantation for leukemia, up to 68% of the patient will develop herpes zoster in the first 12 months, median 5 months. The cumulative incidence of varicella zoster virus reactivation in this group may exceed 80% in the first 3 years. يعني أكثر من 3/4 البيشنت راح يصير عندهم فارسيلا يعني herpes zoster وراء الستيم سيل transplantation for leukemia خلال 3 سنوات. Antiviral prophylaxis has been shown to reduce the risk of reduced zoster in this population. Because zoster is 30 times more common in HIV-infected persons, the zoster patient under age of 50 years should be questioned about HIV risk factors. In pediatric patients with HIV infection and in other immune-suppressed children, zoster may rapidly follow primary varicella. The clinical appearance of zoster in the immunosuppressed patient is usually identical to the typical zoster, but the lesion may be more ulcerative, necrotic, and may scar more severely. Dermatomal zoster may appear progress to involve the dermatome and persist without resolution. هذا يعني immune-suppressed patient. Multi-dermatomal zoster is more common in immune-suppressed patients, including the rare variant of herpes zoster duplex bilateralis, which with involvement of 2 different contralateral dermatomes. Visceral dissemination and fatal outcome are extremely rare in immunosuppressed patients, about 0.3%, but cutaneous dissemination is possible, occurring in about 12% of cancer patients, especially those with hematologic malignancies. In bone marrow transplant, patients with zoster, 25% develop disseminated zoster and 10 to 15% develop visceral dissemination. Disseminated zoster may be associated with a syndrome of SIADA, inappropriate antidiuretic hormone secretion, and present with hyponatremia, abdominal pain, and ileus. This later presentations have been reported in stem cell transplant patients. ممكن يصير عنده syndrome of inappropriate antidiuretic hormone. Despite the treatment with acyclovir, SIADA can be fatal. In this patient, the number of skin lesions may be small, and the lesion may resemble papules rather than vesicles. The mortality rate in patients with zoster who undergo bone marrow transplantation is 5%. Varicella zoster virus immunoglobulin G serostatus is determined before transplant, and the seropositive patient receive prophylaxis with either acyclovir 800 milligram twice daily or valcyclovir 500 milligram twice daily for 1 year or longer if the patient is receiving immune suppressive therapy. In AIDS patients, ocular and neurological complications of herpes zoster are increased. Immunosuppressed patients often have recurrence of zoster up to 25% in patients with AIDS. Two typical patterns of zoster has been described in AIDS patients. The first is erythematous lesion with a punched-out ulceration with central crust or verrucous lesion. هذه هنا صورة على verrucous lesion. هاي صورة عن recurrent zoster in AIDS patients. إذا أما verrucous lesion or erythematous lesions with punched-out ulceration with central crust. These patterns were not reported before the AIDS epidemics. Atypical clinical patterns, especially the verrucous pattern, may correlate with acyclovir resistance. هسه نجي على diagnosis of herpes zoster. The same techniques used for diagnosis of varicella are used to diagnose herpes zoster. The clinical appearance is often adequate to suggest a diagnosis. هو عادة على clinical appearance ممكن نستخدم an in-office T-Zank smear may rapidly confirm the clinical suspicion. Cases of zosteriform herpes simplex can also be positive in T-Zank smear, but the number of lesion is usually more limited and the degree of the pain substantially less than of zoster. Okay, هو الهربس simplex ممكن يكون positive بالT-Zank smear، بس إنه الليجن يعني clinical appearance راح يكون مختلف والsymptoms أيضا راح تكون مختلفة. Beyond T-Zank smear preparation, PCR direct fluorescent antibody testing is preferred to a viral culture because it is rapid, type C virus, and has a higher yield than the culture. Compared with documented varicella zoster virus infection, T-Zank smear was 75% positive, with up to 10% false positive result and high variability depending on the skill of the examiner, and the culture only 44% positive اللي هي نسبة قليلة. أقل من نص الحالات راح تكون positive. PCR testing is 97% positive and is generally the test of choice. ال PCR هو test of choice. بس إحنا مو فعلا راح نستخدمهن يعني clinical practice. In those with atypical lesion, biopsy may be necessary to demonstrate the herpes virus cytopathic effect. Immunoperoxidase IB-stain test can be performed on paraffin-fixed tissue to identify varicella zoster specifically. When acyclovir failed clinically, viral culture may be attempted and acyclovir sensitivity testing performed. It is not standardized to varicella zoster virus as it's not for herpes zoster simplex virus and availability is limited. إنه sensitivity يعني الculture. In histopathology, as with herpes simplex, the vesicles in zosters are intraepidermal. يعني هي intraepidermal فحتى الليجن ما يعرف المفروض سكار أو شيء لأنه هو intraepidermal. Within and at the side of the vesicles are large swollen cells called balloon cells, which are degenerated cells of the spinous layer. Acidophilic inclusion bodies similar to those seen in herpes simplex virus are present in the nuclei of the cells of the vesicle epithelium. راح نشوف acidophilic inclusion bodies موجودة بالnuclei of the cells of the vesicle epithelium. يعني الابيثيليوم اللي يسوي الفيسيكل بالنيوكلياي مالته راح تكون موجودة الأسيدوفيليك inclusion bodies. Multinucleated keratinocyte nuclear moldings and peripheral condensations of the cytonucleoplasm are characteristics and confirmatory of an infection with either herpes simplex virus or varicella zoster virus. In the vicinity of the vesicle, there is a marked intercellular and intracellular edema. بالنسبة للنيوكلير مولدينج المقصود بها إنه يعني الخلايا شلون إنه تنكبس على بعضها البعض فتصير النيوكليا قريبة من بعضها الآخر. In the upper part of the dermis, vascular dilatation, edema, and perivascular infiltration of lymphocyte and neutrophils are present. Atypical lymphocyte may be found. An underlying leukocytoclastic vasculitis, اللي هي type of small vessel vasculitis, suggests varicella zoster virus infection over herpes simplex virus. Inflammatory and degenerative changes are also noted in the posterior root ganglia and the dorsal nerve roots of the affected nerve. This corresponds to the area of innervation of the affected nerve ganglion with necrosis of the nerve cells. Differential diagnosis. The distinctive clinical pictures of Zoster's permit a diagnosis with little difficulty, a unilateral painful eruption of grouped vesicles along the dermatome with a hyperesthesia and on occasion regional lymph node enlargement is typical. Occasionally segmental cutaneous paresthesia or pain may precede the eruption by 4 to or 5 days. ممكن ده البيشنت يجي بس إنه خدر بالمنطقة or pain بهذه الدرماتوم قبل لا يطلع السكين ليجن for 4 to 5 days. فهذا البين يعني وماكو سكين ليجن يشكك ممكن له وايد differential. In such cases or in such patients, prodromal symptoms are easily confused with pain of angina pectoris, مثلا ده هو بالchest, duodenal ulcer, ده بالabdomen, biliary or renal colic, appendicitis, pleurodania, or early glaucoma. يعني ألم بجهة البلورا يعني أو بسبب البلورا inflammation أو غيرها or early glaucoma. The diagnosis become obvious لأنه إذا يعني glaucoma إذا كان بالفيس طبعا. The diagnosis become obvious once the cutaneous eruption appears. The herpes simplex and herpes zoster are confused if the lesions of herpes simplex virus are linear zosteriform herpes simplex virus, or if the number of the zoster lesion is small and localized to the one side not involving the whole dermatome. ممكن مرات يجينا patient كم vesicles بحيث يعني ما طالعة هواي vesicles على طول الدرماتوم فهذا اللي يكون هنا تشخيص confusing. Direct fluorescent antibody testing or viral culture will distinguish them. Direct fluorescent antibody is generally preferred because it's rapid and sensitive. Mpox, formerly monkeypox, tend to present with a larger lesion with a broader central dwelling, donut-shaped, and non-dermatomal, with more genital predominance during the global outbreaks. Rare post-COVID vaccine reaction can include morphologies similar to those lesions of varicella. Prevention of zoster. A vaccine using the same attenuated virus as in varicella vaccination, but at much higher titer, was licensed for prevention of herpes zoster, known as Zostavax, and initially recommended in all patients or in all persons 60 years or older. This vaccination reduced the incidence of zoster by 50%. In addition, post-herpetic neuralgia was 60% lower in vaccine recipient, and the duration of zoster-associated pain was shorter. إذن هم تقلل incidence by 0.5%, تقلل post-herpetic neuralgia, and also shorten the duration of herpes zoster-associated pain. Those vaccinated between 60 and 68 years had a greater reduction in zoster incidence than those over 70 years. But in both groups, post-herpetic neuralgia and the burden of the illness were reduced similarly. هنا ذكرنا البرسنت الريدكشن بصورة عامة بالانسيدنس، بس بالبيشنت اللي أكثر من 70 راح يكون هذا الانسيدنس أقل، بس باقي الأشياء اللي هي zoster associated pain and post-herpetic neuralgia راح تكون نفس النسب. Vaccination had led to reduced rate of emergency department visit and cost associated with zoster in population recommended for vaccination. Because it is a live virus vaccine, persons taking antiviral medications must stop them 24 hours before immunization and do not take them for 14 days after immunization. إذن لما نسوي immunization patients لازم نوقف antiviral medication for 1 day قبل immunization and also stop it for 2 weeks after immunization. Immune-suppressed patients can safely immunize following specific guidelines. A second zoster vaccine has been developed اللي هو النوع الثاني. النوع الأول قلنا Zostavax، النوع الثاني Shingrix, which is now recommended for a healthy adult 50 years and older, and in younger immune-suppressed patients at a higher risk including adults who previously received the first generation shingles vaccine Zostavax and is now the preferred vaccine for the shingles. فده النوع الأول هو حاليا the preferred. This vaccine demonstrated moderately high rate of side effects, including 85% of subjects with injection site reaction pain and myalgia, 66% with systemic reaction myalgia. In clinical trials institutionalized patients who develop يعني ال patients اللي مثلا مستشفى أو دار رعاية develop herpes zoster are infectious to other patients and healthcare team. Prior immunization with a varicella zoster vaccine and adequate serological titers may not prevent acquiring the infection, especially in the immune compromised or immune suppressed patient. Covering the cutaneous lesion, especially with a semi-permeable, dressing not just corresponded appear to reduce transmission. Patients with active disease should avoid unvaccinated, non-immunized, immune suppressed or pregnant patient if possible. يعني هنا يقول prior immunization with varicella zoster or adequate serological test may not prevent acquiring the infection. يعني انت اذا مثلا patients في مكان مجموعه من البيشنت او مجموعه من مثلا دار رعايه او شيء، واحد منهم انصاب وحتى واحد منهم يعني ما اخذ الفاكسينيشن بس هو اميون سبريس ممكن ياخذ الديزيز. فواحده من طرق الوقايه الثانيه انه البيشنتس نسوي له covering by semi permeable dressing حتى هذا يقلل الترانسميشن to the surrounding people. Inflammatory skin lesion after herpes zoster infections يسموها isotopic response. Following zoster, inflammatory skin lesions may rarely occur within the affected dermatome. Lesions usually appear within 1 month or rarely longer than 3 months after the zoster. Clinically, the lesions are usually flat-topped or annular papules in the dermatome. اللي هي هذه الصورة مالتها. اللي هاي dermatome previously affected by zosters develop a granulomatous dermatitis, histologically consistent with the granuloma annular at the site of previous zoster. Histologically, such papules most often demonstrate various patterns of granulomatous inflammation, from typical granuloma annular to sarcoidal reaction or even granulomatous vasculitis. Persistent viral genome has been not detected in these lesions, suggesting that continued antiviral therapy is not indicated. Persistent varicella zoster virus glycoprotein may be the triggering antigen. Topical and intralesional therapy with corticosteroid is beneficial, but the natural history of this lesion is generally spontaneous resolution. Less often, other inflammatory skin diseases have been reported in the area of prior zoster, including ALB, lichen sclerosis, vitiligo, Kaposi sarcoma, graft versus host disease, morphea, and benign or even atypical lymphoid infiltrate. Leukemic infiltrate and lymphoma may affect the zoster scars, as can metastatic carcinoma, inflammatory oncotaxis, or non-melanoma skin cancer. هنا المقصود بالأونكوتاكسيس اللي هي يعني عندنا ليجن معين راح يسوي اتراكشن للمالجنت سيل، يعني مثلا اكو مالجنسي بأذر سايت يسوي اتراكشن للمالجنت سيل انه يصير هنا ميتاستاسيس بهالمكان. هذه الصورة شفناها. هذا فيما يخص الهربس زوستر.